Let's begin. Hello, everybody. My name is Sayed Ijaz. I am the State Advocacy Manager for the Every Life Foundation for Rare Diseases. Thank you so much for being here today for our third State Advocacy webinar through the RDLA Rare Disease Legislative Advocates Program with Every Life. Today, we'll be talking about grassroots and grasstops rare disease advocacy and what that exactly means, and the different ways that rare disease advocates can show up and fight for rare disease issues. If you would like to ask a question, please type it into the Q&A box, and a member of the RDLA team will direct those questions to the speakers at the end of our session today. And then a reminder for media, we ask that media formally announce their participation and refrain from quoting any of the discussion during the webinar. We encourage media to follow up with participants after the webinar for direct quotes. Today with me, I have Catherine Poe, our state policy manager for the Every Life Foundation. We also have Leslie Baldwin, the president and CEO of the Michigan Rare Coalition. And we have Lisa Brackbill, the director of advocacy for patient advocacy strategies. These panelists will be walking us through what rare disease advocacy and lobbying from Grasstops all the way down to Grassroots can look like. Catherine is going to provide an overview of rare disease Grasstops advocacy. Leslie is going to provide us with an overview of what it's like to advocate through a rare disease state organization. And then Lisa will talk about Lisa's story and her journey as an independent rare disease advocate. And then towards the end, we'll have a panelist Q&A with the questions that are in the chat and in the Q&A box. With that, I will pass it over to Catherine to kick us off and talk about rare disease lobbying and Grasstops advocacy. Catherine?
Hello, it's nice to meet all of you. I am newer at Every Life, so if we haven't gotten to meet yet, it's really nice to meet you. And so today I'm going to be talking about rare disease lobbying and grassroots advocacy. Before we start, I just want to say, I know there's a whole variety of folks on this call, whether you are a single advocate working in your state or whether or not you're part of a state organization. This advice is meant to be broadly applicable, so I will try to kind of touch on both. But I think that hopefully folks can get some at least solid definitions of what these terms mean and how they would apply to your work specifically. Next slide. So we're going to go over some just clear definitions about lobbying, what is the difference from advocacy, and we're also going to talk about direct lobbying versus indirect lobbying and how you can partner with Grasstops partners in order to move your bill forward. So what is lobbying? Lobbying is any attempt by an individual or private interest group to influence the decisions of government. And this often sounds like asking directly, like, please vote yes on a specific bill or asking for a specific action. This typically happens through different stakeholders. There are also formal lobbyists or contract lobbyists, for example, that work to represent the views of another organization. So Every Life hires direct lobbyists to work in the states that we partner with. And then there's also advocates and constituents. And so advocates can lobby, but the thing that makes something lobbying, again, is making that very specific direct ask for action. Lobbyists can also be paid and typically have a formal association with an organization. And as you'll see when I talk about like the differences between states, what qualifies someone as like a state lobbyist and as a paid lobbyist can really differ between states. So there are two types of lobbying that states typically recognize as lobbying. So there's direct lobbying, which is essentially going to a meeting, making that ask directly to a sitting lawmaker or their staff. It is any attempt to influence existing legislation during any type of communication with a member. Now, some states actually are very varied in this. For example, I'm from Ohio, and we actually don't consider email communication direct lobbying. So some states have varied opinions about what does and doesn't count, but this is more of a broad definition. So typically, if you're talking to a state lawmaker or their staff in writing, via phone call, any way where you're directly influencing them, that is direct lobbying. Grassroots lobbying is sometimes, it can feel like you're going through a third person. You're asking the general public to contact their legislator. So let's say that you're making a list or a petition or a sign-on letter, or you're putting something out on social media where you're asking other people to ask on your behalf for something. That is grassroots lobbying. So while the focus of this presentation is direct lobbying, grassroots lobbying is also just as important, and it's also typically important for reporting within an organization, keeping track of what is direct and what is grassroots, and how many hours you're spending on either one. So, like I said, like definitions change around the country. There's this really awesome resource through the Alliance for Justice, which actually goes through all of the different nonprofit lobbying reporting standards for the entire country. It is very, very helpful. But the short and sweet of it is that if you are lobbying in a specific state, just always keep in mind that different states have different legal requirements and will typically have specific things that they want you to file, right? And it really depends on your legislature and how they define things. But states always have a different process than the federal system. So this is really important to keep in mind if you're really looking to be compliant and making sure that you're airtight. um, Individual advocates, however, typically don't need to register as a lobbyist. And so we will talk about that next. So advocacy is essentially arguing in favor of a cause or idea, and there is no limit to the amount of advocacy a person or organization can do. And this is really the primary difference. Advocacy is centered around education. It's also centered around things like telling your story or talking to a lawmaker as your own constituent. So, me meeting with my lawmaker in my district and sharing my story would be more of an act of advocacy. Now, you can obviously advocate with broader coalitions. We run advocacy days across the country, but typically these are individuals representing themselves and their own interests. However, some nonprofit organizations will also do this type of advocacy. So it's really the difference between saying, I would like you to do blank, and here's my story, and I hope that this educates you on this topic. So grassroots versus grasstops. What is the difference? Grassroots are the common, ordinary, everyday people. It is the ability to create mass movements and mobilization. It is signing petitions and helping to connect people who have very similar things in common, like having similar, caring about a specific disease. So this is like kind of examples of grassroots. Grass tops is describing an individual who has some kind of extra influence, whether that's through a campaign, a position of power, but they can really mobilize support, and they're sort of seen as an interested party, typically someone that is really strategic for you to have. You often hear this in legislatures around the country. You go to a meeting and they say, oh, well, have you talked to so and so about this? Like, it's so and so in this scenario. It's the person or the people that you really want to have in your corner in order to push a bill forward. Both really have different roles to play in the process. So, for example, on a bill about RUSP alignment, you might have hired lobbyists. You will typically have, people who are doctors or clinicians, people representing hospitals, all these different like grass tops players. And then the grassroots would be the individuals coming and sharing their stories, meeting with people, or often working to gain co-sponsors for legislation. Grasstops advocacy, as I said, is really about building connections with key stakeholders. This is clinicians, researchers, experts, people with some kind of influence. I also like to include journalists in this category. Some people do, some people don't. But local news media is often a really key component to have in your corner. Knowing the people that work on your topic and on your beat specifically, and taking them out to coffee can be the difference between a good story and a bad story coming out about your bill. It's really about creating a network of support of all these people who have some actual skin in the game on your bill and are willing to work with you toward actually achieving the goal. These are often people who have some kind of professional component to it, which is why many Grasstops advocates are also registered lobbyists, because there is that professionalized paid component to lobbying typically, but that's not always the case, right? Someone can also be a Grasstops advocate and be a community member or be a single person who's advocating. It typically just has to do with influence. So if you're someone who's been doing this for 10 years and everyone knows you and people say, oh, have you talked to so and so? That person in my book would probably also count as someone who's grass tops. So what can outreach to these folks look like? It typically looks like trying to make friends. I have a lot of memories of being in hearing rooms with the same people over and over and over again for hours on end and looking around and being like, okay, this is my group of people. I gotta go work the room. That's a great way to make these connections, really taking note of who are you in space with that also you keep seeing, you're seeing them in the hallways, you're seeing them in conference rooms that really tend to care about the things that you also care about. It's also totally okay to do cold open outreach on social media, to do phone calls. I know that they can be very intimidating. However, doing a cold open where you're really explaining your connection and wanting to get to know someone is also valuable. In this day and age, we can all miss emails, but if you see that person again, they might remember that you emailed them at one point wanting to talk. So it's good to try to get as many touch-ins as you possibly can. And then asking your community. The rare disease community is everywhere. 1 in 10 Americans has a rare disease, and that's a huge network of people that you can ask for support. Asking your community, does anyone know someone at this location? For example, Ohio State is a big deal in Ohio. Everybody knows somebody who works for Ohio State. So if you need to talk to someone at the medical center, it's actually fairly easy to get that kind of a connection. So being aware of the fact that people are resources too. They can know a lot of information. And so you want to make a purposeful effort to actually ask people who they know. And then lastly, and this one's a little sneaky, but I have many a times invited someone to speak on a panel because I wanted to network with them. Holding advocacy webinars similar to this one is a really great way to build connection and to kind of get that first step in the door. So if there's someone that you really want to talk to who you just really haven't been able to connect with yet, invite them to speak at your event if it's appropriate. This can be kind of a sneaky way to let people know that you're interested in their expertise and introduce them to your mission. Next slide. My last piece of advice on this is keeping track of your contacts. So when you meet someone new, write them down and make sure that you're sort of developing a system that doesn't just live in your cell phone. So if you're an individual advocate, I actually had a spreadsheet in my Google Drive of everyone that I met when I first started out, which was super helpful. But if you're an organization, making sure that this is in a centralized location, that people who are volunteering, staff members, board members can all get to in one specific spot can help you sort of build on those connections. And lastly, thank you notes. Always write and send thank you notes whenever you meet with someone. And that doesn't just mean meeting with a lawmaker. If you're meeting with a Grasstops partner, it's also important to send them a thank you note, especially if there's someone that you really, really, really need in order to move your bill forward. It's just a really good show of faith. And I think that it makes a strong, lasting impression. People will remember you if you sent them a thank you note.
Thank you so much, Catherine, for that overview on Grasstops advocacy. If you have any questions for Catherine, please feel free to drop them in the chat or in the Q&A box, and we will get to those at the end. But for now, we'll pass it over to Leslie Baldwin, the co-founder and president of the Michigan Rare Coalition, to talk about the organization and some of the advocacy that you can do through a rare state organization. I'll pass it over to you, Leslie.
Okay, thank you, Syed. Um, well, hello out there. It's so nice to be here today. And, I thought Catherine did a terrific job with her segment, very informative. I'm here representing Michigan Rare Coalition. We are recently launched in July, and we are representing the greater rare community in the state of Michigan. And we hope you enjoy learning a little bit about what we're doing. Um, Next slide, please. This slide represents kind of how we wanted to introduce ourselves to the community. The picture that has the young woman and boy is Courtney Lee, who is also a co-founder of Michigan Rare Coalition, and her son Liam, who is born with a rare disorder. Courtney is amazing. When I had talked about with other advocates about starting something like Michigan Rare Coalition, I really was looking to connect with fellow advocates that wanted to make a difference and were interested in connecting communities together. So we really represent the overall community rather than an individual disease. So, and our focus is on raising awareness, providing education to advocates as well as to the public and to legislators. And then, a portion of what we do will also be focusing on advocacy, looking at public health policies to see where are the areas where improvement is needed, what are the current policies, what is their impact on the rare community living here in Michigan. Next slide. So I threw this in. Our website designer, Ben Forad, who is also a member of the Rare community, came up with this, so I can't take credit. But I thought it was really a brilliant way to kind of visualize how many people are living with a rare disorder. In the state of Michigan, as across the US, 1 in 10 people have a diagnosis of a rare disorder. So if you put it in perspective with Michigan State or Michigan, oh gosh, I'm going to be in trouble, University of Michigan, their seating capacity in their stadium is the largest in the US. It's over 107,000 people. And if you had every person in the state of Michigan fill that stadium up, it would be filled up 9.5 times. So that's almost 1 million people that we, look at when we're looking at the overall population, and that's quite a few people when it comes down to it. And I think, helping raise that fact that this is much more common. We may be uncommon in our diagnosis, but the greater rare community, we have a lot in common, a lot of shared experiences that many of us have gone through. And I can speak from personal experience because I'm also a rare disease patient. I was diagnosed in 2009 with a rare primary immune deficiency, and then kind of like many in our community have added on a few more diagnoses for fun. But I think it's just important to know that, in all walks of life, there are many, many people that are affected. It's rare diseases don't discriminate. They're an equal opportunity um, disease factory, so to speak. Next slide. I wanted to highlight my amazing board of directors. I would not be here without them. They are all amazing people and advocates in their own right. Kathy Lewis is with the Amyloidosis Foundation. Kayla Miller is a co-founder. Courtney Lee, who I just showed her photo with her son Liam. Laura Banal is also a co-founder. She is also has her own foundation, the Banal Foundation, Living with Cystic Fibrosis. And she is the vice chair of the Michigan RDAC. Chris Draper, who is our newest member, is our Director of Strategic Advancement, amazing. And Faith Squires is our board treasurer. Okay. One of the things I wanted to kind of focus on today and kind of sharing what we do is how we really visualize the work. I started out when doing advocacy work in Texas, where I lived for 16 years. I worked for Texas Children's Hospital at the time that I was diagnosed. And, I ended up meeting many people in the rare community that were so inspiring and so informative. And so I joined Texas Rare Alliance, which was started by Crystal Davis, very similar to the work we're doing here in Michigan. And, I cannot be thankful enough for the amazing mentors that I've had all along the way to get me where I am today. But so we have Michigan Rare Coalition. What we view is that we want to work and build coalitions with all rare community stakeholders. The center of our community, of course, are community members, patients, families, caregivers, friends, can be coworkers, people that really are in the depths of having to deal with a rare disorder and its impact. Nonprofits, hugely important, community leaders, health professionals, policymakers, and corporate leaders. And I really saw the power of coalitions when I was doing the work for Texas Rare Alliance, and we had a lot of legislative priorities. Through the work that was done, we were able to build coalitions. There were up to 60 different organizations in support of different legislative priorities, like newborn screening, alignment with the RUSP, which we partnered with the Every Life Foundation on. That was passed in 2023, along with a biomarker bill and an all copays count bill. And so I really do feel that by elevating our voices, by connecting with all stakeholders in the community, we have a much stronger position to help move things forward, to make things a positive impact, to really build and work together as we, kind of proceed forward. And that's my hope is what we'll be doing here in Michigan. Next slide. So what are we doing? Since we just launched in July, a few things. We have a website, which I think is essential for any new organization at the state level. You really want to have your visibility. You need to think about what your priorities are and the type of information that you think you are, trying to get out that people need to know. So on our website, we have a section that's a state and federal resource information because so many people don't know where to start, to at least have the information in one central place rather than having to go and, search, different crooks and different little crooks in within the state system or the federal system. We're trying to gather as much as we can so it's easily accessible, downloadable documents with information that we feel is important for rare disease families to have, as well as information about what we're doing. We're inviting Michigan residents that are part of the Rare community to submit their story and share their journey in a section called Rare Gems. So we're hoping to be getting, we've got 2 up right now, and we're looking forward to more. We're going to be starting to post a Rare Community Corner on what's happening around the state, as well as, other conferences or webinars that people might be interested in, so that they have information about it. And then public policy resources and information. We'll be doing webinars that right now we're in the process of planning, but one of the issues that we're really looking at is vaccine, mRNA, and genomic testing. So just a few, so we're working, which is when it comes down to it, it's so important to work with different stakeholders, because certainly my expertise is not in genomic testing. So I, by partnering with different organizations, you can really, I think the message that you're giving, and we want to make sure it's factual information, that it gets out to the community, and hopefully, the community feels comfortable and understanding we're trying to do our best to get information that has been peer reviewed in journals. And I'm really excited to talk about our Michigan Rare Community Advocacy Day at the Capitol. We are partnering with Every Life, the RDLA, for this special advocacy day that's coming up on September 30th. And we're also launching a State of Rare survey, because we felt, being a new organization, we really wanted to get kind of the landscape of what's going on for people in different areas of the state and the rare community, because what might affect someone in the inner city in Detroit or Flint versus someone that lives in the Upper Peninsula, where you have fewer resources. There are different challenges that people may face, whether it's access to transportation, access to a specialist. And we really are hoping that people will respond and share with us what's working for them, what isn't working. So that way it will inform us some of our focus areas as we move forward. Next slide. As I said, this is just a quick slide for our September 30th Advocacy Day. As I said, we have been so excited to be partnering with the Every Life Foundation and doing this work. We will be doing a morning session with speakers. We've invited the chair of the House Health Policy Committee, and he will be coming down to say hello, as well as a representative who is living with a rare disorder. Jason Morgan is also going to be speaking, along with providing information, legislative updates, policy updates. And then in the afternoon, advocates that attend will have an opportunity to meet with their legislator or legislative staff. Next slide. And this is just the visual, kind of put together for, our launch for the survey. And we're hoping to get a robust response from everyone. Next slide. So this is one where I really wanted to just kind of flesh out where we are at in this moment in time. We're looking at, we want to engage, we want people to join us, participate, we want to unite the rare community in Michigan, and we want people to be as involved as as they want to, volunteer, come in and share your story. It's so important. But some of the areas of focus that we'll be looking at are access to a diagnosis, access to insurance, We want to ensure that patients have a seat at the table, or their families or caregivers, when decisions are being made and policies are being written, both at the state and the federal level. Access to advocate for better public policies, really working with advocates and people in the community to have an understanding of what that means and how to do it. And we hope to be able to provide a pathway for that. And then last but not least, access to clinical trials. With the recent cuts in federal funding, we are keeping a very close eye on the research community, what the cuts mean, also the cuts to social programs like Medicaid, to see where things are going to fall out here within the state, and are ready to address some of the issues that might arise and bring that to the attention of elected officials. Next slide. So, in the end, I always believe today is a good day to make a difference. It's a good day to start. It takes baby steps, but I believe everybody can do this, or someone in your life can help you with it. We are here to help. We want people to build their own advocacy toolbox. Fill your toolbox with the things that are meaningful to you. Engage, learn, advocate. There's a lot of different ways that you can participate. And, we really believe that by doing the work that we're doing, we can be stronger together. We will have a united voice with a lot of people. And that's sometimes what you need to propel things forward. Next slide. And this just has our contact information. I'm a big believer in adding QR codes to make it easy for people for access. So the QR code, you can use that to go to our website and kind of look around and see what we have on there. We're always working on adding new information and resources to the website. But this is where we're at this time. And I just want to thank you so much for giving me the opportunity to share a little bit about what we're doing.
Thanks so much, Leslie. If you all have any questions for Leslie, please feel free to drop them in the question and answer box or in the chat. At this time, we'll move forward with our final presenter, Lisa Brackbill, who's the Director of Advocacy at Patient Advocacy Strategies. Lisa, over to you.
Good afternoon, and thank you so much for the invitation to speak today. I'm going to be sharing about how my advocacy journey began alone, but it evolved into a collective effort. So even though I wasn't working with an organization, I really wasn't alone. It just took me time to find my team. For those who aren't familiar with me, as he said, my name is Lisa Brackbill. Like many of us, I did not initially choose to become a rare disease and newborn screening advocate, but I cannot deny that it was always supposed to be my story. 11 years ago, we welcomed Victoria into our lives. She had big eyes, lots of hair, and she brought us so much joy. But when she was 5 months old, everything changed, and it was clear that something was terribly wrong. After a 6-week diagnostic odyssey, we received the answer no parents want to hear. On Friday, February 13th, 2015, we were told that our 6-month-old daughter was dying. She had Krabbe disease, a rare terminal genetic condition. When we pressed the neurologist for options, she gently told us that if we had caught it at birth, we could have treated it. Next slide. In that moment, my life's purpose became clear. My political science degree and lobbying experience suddenly had a purpose. But first, I had to become a caretaker. My first year of advocacy was during her last year on Earth. I did what I could from my recliner with one arm holding my daughter and the other learning everything I could about newborn screening on my newly obtained smartphone. The day my daughter was diagnosed was the worst day of my life. The day she died began my advocacy journey. At first, I lacked confidence because I was on my own. I didn't have a nonprofit behind me, and I thought that would lessen my legitimacy. I had no idea where to begin, so I found my path one conversation at a time. With each one, I found another person who became a part of a team I didn't even know I was building. I learned that advocacy is a process, not an instant solution. My initial vision of what would define success was blurry, blinded by grief, anger, and frustration. I just wanted Pennsylvania to screen for Krabbe disease. It seemed so simple, and it felt like the state was simply choosing not to screen for it. But as we all know, feelings are not always reality. My first step was attending a newborn screening advisory board meeting just 3 weeks after Tori died, and that meeting revealed a broken system. Among other problems, I learned that the board didn't have the authority to add new conditions, which caused delays and refusals. As the advisory board chair said after one particular budget refusal, "Why are we even here?" At that moment, I knew my job was bigger than expected and that my impact could be far greater. The first lesson I learned is that states have created a pathway for us to implement changes in newborn screening and in other policy areas, but this is my focus. Just because there are potholes and detours along the way doesn't mean that we throw away the map. We need to ask for directions, and it means we may need to help fix the potholes. So that's what I set out to do. I set out to fix the potholes that were in my way. Next slide. Despite what Schoolhouse Rock and my political science degree had taught me, this was anything but a straightforward process. I started working with legislative staffers who became my friends, and we crafted our first piece of legislation to remove the barriers, only to have it die in committee without ever being heard. We had a bipartisan bill with no opposition, but it failed. I had no idea that it would take more than one attempt. But over the next 5 years, there would actually be 3 legislative attempts to fix the regulations, with partisanship halting progress on the first 2 bills. Never did I imagine that it would take 2,292 days from the day of Tori's diagnosis to the day the law would be implemented. And never did I imagine that the leadership of the legislature would look only at the party of the sponsor and not at the merit of the bill. For that reason, I'm not sure in retrospect that having an organization helping me would have made things go much faster. Here's a quick timeline of the first 3 years. I spent a lot of time learning everything I could about newborn screening, Pennsylvania's system, and what needed to be fixed. I had conversations with anyone I could think of, and from those conversations, I found more stakeholders with whom to speak. I was in the news, and I did everything I could think of to raise awareness. Oh, sorry. In parallel, I kept urging the Newborn Screening Advisory Board to add Krabbe disease to Pennsylvania's newborn screening panel. Next slide. While HB 1081 was sitting in committee, we entered 2018, which turned out to be an extremely busy year. That's an understatement, of course, because I not only released my book, but I gave birth to our identical twin sons, Isaiah and Caleb. Needless to say, I did not have much time for advocacy, and I continued to just hope that the bill would move along like it was supposed to. But it didn't, and it died in committee without ever being heard. And this is when a team would have been extremely helpful. We introduced our second attempt in 2019 when the new session started. Again, it went nowhere. On September 25th of that year, I was at the Capitol for a newborn screening awareness event, and I spontaneously stopped by the Speaker of the House's office to see what I could learn about the status of my bill. I was told by his policy advisor that my bill was dead, and he said, quote, "They don't want to give a Philly Democrat a win." I was furious, to say the least, that partisanship was going to cost lives. As a side note, this is also the day I became nonpartisan. This frustrating news allowed me to pivot, and I learned the important lesson of being flexible when it comes to effective advocacy. Adapting to political realities, such as finding new sponsors, revising bill language based on stakeholder input, and building a supportive team, can make the difference between success and failure. Advocacy requires responsiveness and collaboration behind the scenes. So with the help of my behind the scenes team, which now included that same policy advisor, we switched tactics. We found a new sponsor in the majority party in the Senate, and we drafted a companion bill. SB 983 was introduced in January of 2020, and I don't have to tell you what happened next. Obviously, the legislature soon shifted focus to COVID-19, and our bill was in jeopardy, which was honestly devastating to me. But my team and I wouldn't give up. We held virtual stakeholder meetings over the summer to strengthen the bill as we prepared for what felt like an inevitable fourth attempt. But in a remarkable 65 days, it went from the committee to the governor's desk and became Act 133 of 2020. This took a tremendous amount of effort in those days, but we did it. This success was the culmination of everything we learned from our previous attempts. I learned then that quick progress doesn't always mean effective progress. And I know you don't want to hear that because I didn't either, but it's true. It took time for us to figure out the right answers and to make adjustments to our final bill that made it stronger. While it may have appeared publicly that I was a lone advocate, I was not. The legislative staffers, legislators themselves, and my former lobbyist boss were just a text away. They couldn't be publicly involved, but they were my lifeline. This photo, taken at the ceremonial signing of our bill, which didn't happen until September of 22, shows our team finally together. It's a tribute to the power of collaboration, even when it's behind the scenes. And of course, without my husband Brennan's support behind the scenes, none of this would have been successful because somebody had to watch the twins. On May 24th, 2021, the culmination of our efforts was seen as the law went into effect, and these are the things that it fixed. In addition, the state also began screening for Krabbe disease because of the advisory board's approval, and we became the 9th state to do so. The impact of this law became clear just 67 days later. Identical twin boys were born and diagnosed with Krabbe disease because of newborn screening. They were born on Tori's birthday. I didn't know their names or anything about them at the time, only that their parents had options for treatment that we didn't. But July of this year, I got to meet them. I got to play with them, and I will never forget the moment I shared with their mom who I was and how our stories were intertwined. The fruit of our advocacy work in rare disease is often unseen, but this moment was a beautiful, tangible reminder of what we accomplished and why. I've certainly seen the pros and the cons of the approach I took in Pennsylvania. When I began advocating, I was grieving and angry, and it genuinely never occurred to me that there might be organizations that could help me. In retrospect, I really wish that idea had crossed my mind because it would have been a much more enjoyable process. On the pro side, I was able to be incredibly flexible and adaptable without needing to ask permission from anyone. Decisions could be made in the moment, which proved to be critical. Also, given my proximity to Harrisburg, just 15 minutes away, it was easy for me to drive to the Capitol for meetings or advocacy purposes. I didn't need to coordinate with others or travel long distances. I could also be as bold as I wanted when speaking with them, and I found that stakeholders were very willing to help me because I was just a mom. They wanted to see me succeed to help redeem my family's tragedy. This direct personal approach opened doors and helped me obtain information, we could even call it intel, that would have been extremely challenging to get as a paid lobbyist or a representative of a large organization. Of course, the cons are obvious. It was mostly me making all the phone calls, and I also had a spreadsheet to guide me because Pennsylvania has 253 elected legislators. So I had to keep track of it all. I had to send all the emails, and I had to figure all of this out as I went because there was no roadmap for me to follow. I made plenty of mistakes along the way. While I had contact with the Department of Health and the Newborn Screening Advisory Board the entire time, they could not be publicly involved or speak to legislators, so I had to be the public face of the effort. At first, as I said at the beginning, I felt that having a group behind me would have added legitimacy, and I do think that's true in many situations. But in my situation, the power of a mother who had just lost a child and was trying to save others seemed to have the greatest impact. I want to note that my experience does not negate the importance of groups or organizations. Sometimes they simply don't exist in your area, they lack resources, or an individual's action is what's needed most. So ultimately, I learned that my story, my passion, and my ability to connect with stakeholders gave me the legitimacy and confidence I needed to continue. This is why it's so important to be willing to have conversations with those who know the system best. Don't be afraid to start. It just takes a phone call. Be yourself, and you will figure it out as you go. You can always bring others in as you move along, but taking that first step is a requirement. Whatever your advocacy desires may be, I hope that your journey is way easier than mine, and that you quickly find allies to make the process more efficient and effective. Thank you.
All right. Thank you so much for that wonderful presentation, Lisa. And thank you to all of our panelists for presenting today. I'm going to do one last call out for any questions. We don't have any questions in the Q&A or in the chat. Seems like everyone gave some really thorough information. And I'm glad that folks were able to get a bit more educated on Grasstops and grassroots lobbying. What I'm going to do is I'm going to shift over to the announcements, and if anybody does have any questions, feel free to drop them in the chat during that time. And then if we do have any, we can proceed forward with the Q&A. Announcements wise, please keep these dates on your calendar. The next RDLA webinar will be on Thursday, September 25th from 3 to 4 p.m. Eastern Time. And the next Share Your Story webinar will be on Thursday, October 9th from 1 to 2 p.m. For more information, please check us out at everylifefoundation.org/rare advocates/webinars, and you'll find more information about RDLA's programming there. Seeing no additional questions in the chat or the Q&A, I think we can adjourn for today. A recording of this webinar will be on the website within the next day. And thank you all for hanging out with us today. I hope you all learned a little something about Grasstops and grassroots rare disease advocacy, and a big thank you to our panelists. Enjoy the rest of your afternoon, everybody. Thanks.
Thank you.